issue now. The U.S. President Donald Trump has suspended funding to the World Health Organization. Mr. Trump has accused the health body of covering up coronavirus outbreak and also failing to adequately obtain, vet and share information on the pandemic, being the largest contributor to the WHO. How is this likely to impact efforts to contain the fight against coronavirus globally, COVID-19? So I will be engaging a health economist shortly on this development. But first, let's take a look at the funding of WHO by member countries. And you can see on your screens right now, if you see that graph there, the member states funding for the WHO. US, I said earlier on, is the largest. And if you look at the figures, it's 22.0% for the US, and then that comes up with 12.0% from China, and then Japan contributes about 8.6% to the World Health Organization. Germany follows with 6.1%. And so the rest of the world, all the member states, contribute about 51.3%. And last year alone, we are told that US contributed about $400 million towards the WHO. So, like I said earlier on, how is this likely to impact the operations of WHO, especially when we are having a global health crisis? We've been speaking to a health expert economist on this development.
What is critical is that we have two main streams of income for the WHO. We have the access contribution, which is a measure, is what every member state contributes, which is a percentage of their GDP. Now, the second part is donors and partners contribution, sometimes which is also voluntary. This comes from foundations, charitable organizations, business communities, and stuff. All of these are aimed at supporting the strengthening of health systems across the globe. So what contribution the U.S. gives is not only to help the U.S. itself, but to help the entire world. Now, the annual contribution, I think, is 40% of the annual budget. It's critical to understand that the key areas that WHO works in, the three areas, key three areas, would be the social determinants of health, universal health coverage, and health emergencies. Now, I think the focus of the COVID-19 is with health emergencies, so we'll focus on that. It's important that in this fight with COVID-19, we understand that countries with weak health systems are going to suffer the most. If we look around what is going on right now, even so-called advanced economies are on their knees. So when countries have gone through the full cycle of the pandemic, where the disease has spiked and there are quite a number of deaths, we will see just how weak a lot of countries are and how unprepared they have been. So
by this, Dr. Asmani, Ghana should be concerned.
I think that, yes, we should be concerned, but we should not feel hopeless. Let me tell you why. If, let's say, the U.S. takes away its 40%, of course, it would also affect our bottom line 40% less of what our health system, what WHO Ghana would have, right? So, but we also always, every government that has come with our health budget, we have a deficit. And the deficit is covered by our development partners and the donor community. So, for instance, we have the COFI, USAID, the JICA, World Bank, DFIDs, who also make up for the deficit in our health budgets, okay? So, if, for instance, we are going to have a shortage from the World Health Organization, which supports us with technical assistance predominantly and some financial support, I think not very significant financial support, but the capacity building aspect is very critical in a fight like this.
Okay.
So that was Dr. Aboagye-Wiafe and speaking to my colleague MFR Powell earlier during the day. But